How to increase bone health after the age of 50 and relieve pain. Welcome back to our channel. Today we will be discussing some effective tips and exercises to increase bone health and alleviate pain, specifically for individuals over the age of 50. Segment 1. Importance of bone health. Host. As we age, our bones naturally become weaker and more prone to injury. That's why it's crucial to take steps to maintain and improve our bone health. By doing so, we can reduce the risk of fractures and osteoporosis. Segment 2. Balanced diet. Host. One of the most important factors for bone health is having a well-balanced diet. Ensure you take enough calcium, which is found in dairy products, green leafy vegetables, and fortified foods. Vitamin D is also vital for calcium absorption, so spend some time outdoors or consider taking supplements. Segment 3. Regular exercise. Host. Engaging in weight-bearing exercises can help strengthen your bones and relieve pain. Activities like walking, jogging, dancing, and weightlifting are great choices. Remember to start slowly and gradually increase the intensity to avoid overstrain. Segment 4. Yoga stretching. Host. Yoga and gentle stretching can improve flexibility, posture, and balance, reducing the risk of falls. Try incorporating poses such as Warrior 2, Triangle Pose, and Downward-Facing Dog into your routine to promote bone health. Segment 5. Resistance training. Host. Including resistance training exercises with weights or resistance bands can improve bone density and strength. Exercises like squats, lunges, and bicep curls can help target different areas of the body and promote overall bone health. Segment 6. Lifestyle habits. Host. It's essential to maintain a healthy lifestyle for good bone health. Avoid smoking as it can decrease bone density. Limit alcohol consumption. Get enough restful sleep, and manage stress levels. Segment 7. Consultation with healthcare professional. Host. If you're experiencing persistent pain or have any concerns about your bone health, it's essential to consult with a healthcare professional. They can provide personalized guidance and recommend appropriate treatments or therapies. Conclusion. Host, thank you for watching. By following these tips and incorporating them into your daily routine, you can improve your bone health after the age of 50 and alleviate pain. Remember, it's never too late to start taking care of your bones. Don't forget to like, subscribe, and share this video with others who may find it helpful. Here are some calcium-rich foods that you can include in your diet for better bone health. 1. Dairy products. Milk, cheese, and yogurt are excellent sources of calcium. Opt for low-fat or non-fat varieties to keep the calorie content in check. 2. Leafy green vegetables. Include vegetables like kale, spinach, collard greens, and broccoli in your diet. They are not only rich in calcium but also provide essential vitamins and minerals. 3. Soy products. Soybeans, tofu, and soy milk are good plant-based sources of calcium. They are also great options for those who are lactose intolerant or follow a vegan diet. 4. Fish. Certain fish, such as salmon and sardines, are not only rich in calcium but also provide omega-3 fatty acids, which are beneficial for bone health. 5. Nuts and seeds. Almonds, sesame seeds, chia seeds, and flax seeds are all packed with calcium. They can be enjoyed as a snack or added to various dishes. 6. Fortified foods. Many cereals, bread, and other food products are fortified with calcium. Check the labels and choose options that have added calcium. 7. Beans and legumes. Incorporate beans like chickpeas, black beans, and lentils into your meals. They offer a good amount of calcium along with fiber and protein. Remember, it's important to consume these foods as part of a balanced diet to get the most benefits. The recommended daily intake of calcium varies depending on age and gender. Here are the general guidelines for daily calcium intake. 1. Adults aged 1950, 1,000 milligrams mg of calcium per day for both men and women. 2. Men aged 5170, 1,000 mg of calcium per day. 3. Women aged 5170, 1,200 mg of calcium per day. 4. Adults aged 71 and older, 1,200 mg of calcium per day for both men and women. Pregnant and breastfeeding women may require higher amounts of calcium, so it's always recommended to consult with a healthcare professional for personalized advice. Remember, it's best to get your calcium from a variety of food sources rather than relying solely on supplements. Consuming too much calcium can have potential risks. Here are a few things to consider. 1. Kidney stones. Excessive calcium intake, particularly from supplements, may increase the risk of developing kidney stones in some individuals. It's important to stay within the recommended daily intake and consult with a healthcare professional before taking calcium supplements. 2. Interference with medications. High levels of calcium can interfere with the absorption and efficacy of certain medications, such as antibiotics and thyroid medications. If you're taking any medications, it's best to talk to your healthcare provider about any potential interactions. 3. Digestive issues. Excessive calcium intake, especially in supplement form, can cause digestive issues such as constipation, bloating, and gas. If you experience any discomfort, it's advisable to adjust your calcium intake or speak with a healthcare professional. It's generally recommended to get calcium primarily from food sources, as they provide a balanced combination of calcium and other essential nutrients. If you're considering calcium supplementation, it's best to consult with your healthcare provider to determine the appropriate dosage for your specific needs and to monitor any potential risks. A simple yoga pose that can help promote bone health is the triangle pose, Trikonasana. Here is how you can practice it. 1. Start by standing with your feet about 3-4 feet apart, with your arms relaxed at your sides. 2. Turn your right foot out 90 degrees so your right toes are pointing to the front of the mat, and your left foot is turned slightly inward. 3. Inhale and raise both arms out to the sides, parallel to the floor, palms facing down. 4. Exhale and reach your right hand forward, tilting your torso to the right side. Lower your right hand down to your shin, ankle, or the floor, wherever it feels comfortable and allows you to maintain balance. Extend your left arm straight up towards the ceiling, with your palm facing forward. 5. Gently turn your gaze to look up at your left hand, keeping your neck aligned with your spine. 6. Hold the pose for 30 seconds to 1 minute, breathing deeply and maintaining balance. 7. To come out of the pose, inhale and press firmly through your left heel as you engage your core muscles and come back up to a standing position. Lower your arms back down to your sides. 8. Repeat the pose on the other side, turning your left foot out and reaching with your left hand. The triangle pose helps to strengthen the legs and improve balance while stretching and opening the chest, shoulders, hips, and spine. Regular practice can help improve bone density and promote overall bone health. As with any yoga pose, listen to your body and modify or skip the pose if you experience any pain or discomfort. It's always a good idea to consult with a qualified yoga instructor before starting a new exercise routine.